that I was first sat down to kind of hear what late effects was.
It was laid out for me pretty in-depth, all of the potential long-term side effects.
And I think after you stop treatment, the focus for about 5 years after is on keeping you well.
Now let's look at the bigger picture. What do I need to do to make sure I stay healthy, not only for myself, but for my family as well.
I realized that I really didn't have a long-term follow-up specialist or program that I was involved in. That's when I found the STAR program.
The STAR program is a comprehensive long-term follow-up program. For our adult survivors, we treat patients for their annual follow-up care. They have to be diagnosed with cancer at age 21 years or younger. We do one-on-one patient education when we're in clinic, talking about what risk factors patients have and having them continue to understand why are we doing this follow-up care.
It was kind of hard because I've been in the children's hospital for a long time and I knew my doctors and I knew my nurses.
Treating someone who is a cancer survivor, you're introducing all these different variables that most regular doctors haven't been exposed to.
I wasn't getting, the proper information until I finally got to my follow-up care that I'm at now, and now I'm getting the information that I really needed.
So I think that it's important that we help the patient then kind of become their own advocate. Of course, in pediatrics, depending on when the patient was diagnosed, we tend to deal with the parents, and the parents answer the questions and the parents set up the appointments. But the ultimate goal of transitioning to adult care is that the patient will become independent and sort of take ownership over their own follow-up care.
I think it's really important to be proactive about your own health. I would also say to try to get into a program that will help you with that, but if you're not in a program, definitely know your drugs, know the treatment that you received, be conscious of the fact that their side effects are a real possibility, and talk to your doctors.
I know that there are a lot of obstacles out there that might prevent individuals from being able to seek that care, whether it be healthcare access or insurance issues or even just financial issues. There are certainly long-term follow-up issues that need to be monitored, and the best thing you can do for yourself is to be your own best advocate.
Medical records are an important piece for a survivor to have their hands on, and some of the medical records that are important can be compiled into a treatment summary, and this summary should ideally be compiled and presented to them by their treatment center. Patients should at least try to get their information about their dated diagnosis, the staging perhaps, the name of their cancer that they had, and then also if they were on a treatment protocol or a study. We want to know the list of chemotherapy agents that they were treated with, and we also want to know the dosages of certain type of drugs. If they were treated with radiation, we'd like to know the dosage and sites of the radiation. If they had surgeries, what were the surgeries' names and approximate dates. And if they had any significant complications during treatment, then that would be useful to know as well.
The journey of childhood cancer doesn't end the day that treatment ends.
It's a marathon because there are so many more hills along the way that are going to be struggles throughout your life, and that you have to keep persevering through that.
Following up treatment for long-term effects, I feel is just as important as the initial battle. And so I definitely find no matter where life takes me in the future, it's definitely going to be something that I'm always going to want to keep track of.